Good morning. Welcome to friends, colleagues, and supporters who've joined us for this special announcement. I'm Stephen Barnes. I'm the Chief of the Division of Acute Care Surgery at the University of Missouri School of Medicine and the principal investigator on the grant we're here to celebrate today. I would first like to begin by thanking the university leaders who joined me in delivering marks on the stage today. I'm very grateful to MU's Vice Chancellor Robert Duncan, MU's Vice Chancellor Hal Williamson, and School of Medicine Dean Robert Churchill, and my chair Jerry Rogers, who will help me recognize the many contributors to this grant award today. Before I delve into the details of the grant, I want to briefly explain the research this new funding will support. This grant will establish the University of Missouri Combat Casualty Training Consortium, one of two groups nationwide established in 2011 to evaluate and refine the curriculum used to train our first responders on the battlefield. The funding will support our researchers in evaluating the effectiveness of existing combat medic training methods in three critical research areas: hemorrhage control, airway management, and emergency medicine skills. As a former Air Force surgeon, I can tell you that it is very difficult to convey the seriousness of the situations that our nation's sons and daughters face when they are serving in harm's way. Combat medics are the first responders to help our wounded warriors, so it is critical that these healthcare providers receive the absolute best training. Our consortium of experts will assess the effectiveness of current methods and ultimately recommend how the Department of Defense will train combat medics to be prepared to save lives in the future and on the battlefields of the future. To tell you more about this grant and our national partners that are here today, seated in the front row, I'm pleased to welcome Dr. Robert Duncan, MU's Vice Chancellor for Research, to the podium. Dr. Duncan.
Thank you very much, Dr. Barnes. Thank you very much. Thank you very much, Dr. Barnes. This is truly a very exciting day. It's my pleasure to join you and your colleagues in announcing this grant and celebrating the advancements you'll make in the training of combat medics, so critical to our country. I am proud to inform everyone that the University of Missouri has received a $5.3 million grant from the Department of Defense to establish MU's Combat Casualty Training Consortium. On behalf of the University of Missouri, please join me in applauding the outstanding group of physicians, scientists, and educators who received this federal award. I'd also like to take this opportunity to recognize our other institutions that will partner with the University of Missouri to perform this research. They include, and let me ask maybe a representative from each of these institutions to please stand as I mention your institution, the University of Alabama at Birmingham, the University of South Florida, the University of Central Florida, and the Information Visualization and Innovation Research Firm. In addition to the consortium members based in Florida, and again, thank you so much for your participation in this important grant. I was just going to say, in addition to the consortium members based in Florida and Alabama, this team will draw on the nationwide pool of resources for improving training from Harbor UCLA Medical Center to the U.S. Air Force School of Aerospace Medicine. The members of the consortium form a group of 30 civilian and military experts from around the country. So again, it's this outstanding team, many of whom are with us here today, that make this great program possible in the national interest. So again, my great appreciation to our partners in this regard. Several representatives from the consortium's partner institutions have traveled to MU today. We're delighted to see that. And it is now my pleasure to introduce Dr. Hal Williamson, our Vice Chancellor for MU's Health System, who will tell us about how this project connects the broader efforts at our comprehensive academic health center to our activities and research and the national agenda. Thank you very much.
Thank you, Rob. And for those of you who are paying close attention up here, what we have is an agility assessment going on over here, because we got three large and agile guys that are leaping around on a pretty small platform. But we do have a trauma surgeon, so I think it'll all be all right. So thank you, Rob, and congratulations again to the researchers at MU and elsewhere. I really didn't realize that we had so many partners. That's just a wonderful thing, and that's where the future is headed these days. It seems that I've been celebrating large federal grants for the medical school a lot lately. Thank you, Bob, and don't stop. In the past 18 months, we've held several ceremonies for similar multi-million-dollar grants. The funding from these awards now support teams here at MU and around the country studying cardiovascular disease, medicinal plant research, in fact, around the world, electronic health records, nanotechnology, and ways to improve the mental health and well-being of children here in Columbia and our community. And there are a couple of important reasons why MU is able to secure large federal grants and lead national teams in advancing medicine, and I think it's important that we all pause and understand how that works and what it is to have an academic medical center as a part of a large university. First, MU is fortunate to have a comprehensive academic health center on an AAU flagship campus that supports and encourages, in many ways, collaborative and multidisciplinary research. It shouldn't go unnoticed by anyone. This kind of thing isn't an accident. This interdisciplinary culture creates ideal environments for outstanding education, research, and patient care, the kinds of things that will be the downstream effect of the funding that's being announced today. MU also is fortunate to have focused resources in terms of the talent of its faculty and the reputation of its programs. With investment from MU and others, and some great leadership, we've been able to develop an outstanding clinical simulation center, a wonderful trauma center, which is a resource for our whole state and beyond, and an outstanding surgery department. All of these programs were leveraged to receive the award that we're celebrating today. And investment in our surgical programs continues. I think Dr. Rogers wrote this part. Partly, the support for surgery on our campus continues with the 7-story structure over here. You may have seen the cranes on the south part of the campus. That 7-story structure will house several operating rooms and patient care areas that, again, relate to this growth in surgery that Dr. Barnes is so much a part of. To explain the programs involved with this grant in more detail than I know, actually, I'd like to welcome Medical School Dean Bob Churchill to the podium. Bob?
It's fairly awkward. Well, one of the things about not going first is it makes my remarks a lot shorter because a lot of what I was going to say have already been said, so this will really be short. And so I want to, again, congratulate Steve and the whole team for, pulling this off. And the fact is, though, this didn't just happen. I mean, as Hal mentioned, there's a lot of background here at the University of Missouri that really teed it up for us to be successful in this grant. And, one of the questions that I'd like answered at some point in time is, why are all our research partners from southern schools? I didn't see nobody here from Minnesota or North Dakota or New York. Anyways. So, like I said, this doesn't just happen. First of all, we have, now I know they want to be called acute care surgeons these days, but to me they'll always be trauma surgeons. And I've worked at 2 places only that had level 1 trauma centers. And I've been here for a little over 24 years. I can say this with a straight face, that the trauma surgeons that I've worked with here the whole time I've been here are as good as anybody on the planet. So that's one of the reasons that we were successful. Another one is because we have a really nationally recognized trauma center here, and we've had one for a long time. And we also have the simulation center that Hal talked about. So let me just, Frank's going to hate this, but I'm going to have Frank stand up and take a bow here. Frank Mitchell was a colleague. We were colleagues for a lot of years. Come on, Frank. And our trauma center isn't named after him by accident. Frank really ran a very good, nationally renowned trauma center here. As a matter of fact, he was one of the people on the American College of Surgeons that helped define the golden hour and put all the rigorous standards in place that you had to follow to be called a level 1 trauma center. So we have that history, I think, that helped us with the grant. The other thing we have is we have this wonderful simulation center here that was funded by Russell D. Sheldon. He's an anesthesiologist, and his late wife. It is a Star Wars simulation center, and it is really an integral part of our medical school curriculum and how we teach medical students. We also use for teaching residents and faculty and nurses. And I think that without that, we probably wouldn't have been as well positioned as we are. So once again, I want to thank everybody, all the scientists, the people that were part of this grant. And once again, I want to thank our trauma service here and Frank Mitchell, that there are countless people who are alive today in Missouri and in the United States that wouldn't be if it hadn't been for the things that Frank Mitchell and his colleagues have done over the years. So turn this over now to Jerry.
It's pretty easy to get over here from that side. So thank you, Dean Churchill. So I'm pleased to be here with you today also to celebrate this milestone for the University of Missouri, the School of Medicine, and the Department of Surgery. The grant that has been announced this morning confirms what we've known for a long time, and that Dr. Barnes is one of the most outstanding young surgeons in the country today. We've talked a little bit about the grant. Let me talk a little bit about Steve. Steve got his medical degree in Alabama, in Birmingham, which incidentally is a partner in this research consortium. Okay. After completing his surgical residency at the University of Kentucky, he then completed fellowships in trauma, surgical critical care, and advanced laparoscopy and gastrointestinal surgery. So that's kind of a little bit about his background. Some of you may not be aware that Steve is not a stranger to combat trauma and the environment in which it occurs. He spent years teaching life-saving skills to flight surgeon teams before they deployed into battle. In 2006, 5 years ago, he served in Iraq as Chief of Critical Care and Medical Director of the Intensive Care Unit of the 332nd Air Force Theater Hospital at Balad Air Force Base. Following his tour of duty, when most of us who had military careers were finished, he was assigned to the University of Cincinnati, where he directed a critical care air transport training program for the United States Air Force for sustainment of trauma and readiness skills. Finally, he saw the light. In the fall of 2008, Steve joined us here at MU as the Division Director of Acute Care Surgery, or as Dr. Churchill says, Trauma and Surgical Critical Care. He has brought great recognition to that both internally and throughout the state and nationally. The residents that he has helped train, the fellows that he has helped train have been on national panels, regional panels, and state panels. Okay. As Dean Churchill said, the University of Missouri Hospital is a verified level 1 trauma center both at the state and by the American College of Surgeons. No small task. The partnerships that Dr. Barnes has formed with national institutions, as well as the respect that he has gotten from faculty, residents, and students, are a testament to his skills as a teacher, a physician, and a leader. Please join me in congratulating Steve on receiving this federal award and thanking him for the recognition that he brings to our campus.
Wow. Now I know why you didn't let me see the rest of it ahead of time. Thank you all for coming. It's a pleasure to celebrate this with you. Please join us for some refreshments, meeting our partners, and meeting our friend with the injured leg here in the front of the room. Thank you so much for coming.